Dr. Chris Labos is a cardiologist with a degree in epidemiology and a regular contributor here on CJAD. I think I mentioned to you last time we talked, Chris, that I wanted to ask you about this, so thank you for coming back. So we're talking this time around about a variety of studies showing that younger and younger people are developing diseases typically associated with an older cohort. In fact, and I read this and did a double take, while some cancers have been declining in older people, some of these studies show that cancer is on the rise in younger adults. So what's going on here exactly?
Yeah, so here's where we have to be a little bit careful with the numbers and the math. And this is really a case where the devil is in the details, because cancer mortality is going down, and that largely reflects the fact that we have better treatments for cancer than we ever did. But as screening programs have become more and more expanded over the years, when you look back over the past 20 to 30 years, so you compare like the 1970s, the 80s, the 90s, and now after 2000, because we do more cancer screening than we used to, because we are more aggressive at detecting earlier cancer than we used to be, you make more cancer diagnoses, but you have less cancer mortality.
Okay.
And so I don't know that this finding is as scary as it is sometimes portrayed to be. Obviously, nobody wants to get a diagnosis of cancer. And there is an element to this of the fact that, as obesity rates go up, as people are maybe not exercising as much as they used to, where diet is maybe a less healthy than it used to be, as people eat more and more junk food and pre-processed foods, there's certainly an element of that in there. But I think a lot of these numbers are really just reflective of the fact that, if you do more cancer screening, you will find more cancer. What matters to a large degree is whether people are actually dying from their cancer. And there we can say quite definitively that cancer mortality across the board is pretty much down for the majority of cancers.
So let me go to one specific one. I saw this one and thought, wow, it seems to me when I'd heard of fatty liver disease, this was definitely, something that older people got. We used to think encouraged by drinking. Now you're seeing younger people getting this specifically, fatty liver disease. What is it, and are you concerned by what we're seeing?
I mean, I'm concerned in the sense because it is kind of the same problem. So let's be very clear about what we're talking about. Fatty liver disease, what we usually refer to as non-alcoholic liver disease or non-alcoholic steatohepatitis when it gets more severe, that specifically means that the liver disease that you are seeing is not due to alcohol and not due to the hepatitis virus. So it's not due to Hep A, Hep B, Hep C. This is usually a consequence of obesity, metabolic syndrome. So again, a lot of the lifestyle factors that lead to the accumulation of fat in the liver, which then leads to inflammation and can lead to, chronic damage if you don't reverse it. And so you are right. This is something that you used to see in older people, especially as we start to pack on the weight during middle age. But we're seeing it more in younger people now because we are seeing more childhood obesity than we did a generation ago. And so this condition, which we used to call MASH for non-alcoholic steatohepatitis, which we now call MASH for metabolic-associated steatohepatitis, just reflecting the fact that this is often a metabolic consequence. The treatment really does have to be to address risk factors, to address obesity, and try to improve the metabolic profile of the individual, of the patient, in this case the child, because this is a reversible condition, especially if you catch it early enough and you can, not allow the obesity to progress into adulthood.
Seems like a pretty simple solution, though, to your point, right? If you notice this childhood obesity, which you said is rising, of course, and we know that, for a doctor, for example, for your GP to simply say, look, this is unhealthy, and that argument will be made, well, is it really unhealthy? What, change nutrition, go to the gym, work out, do something, do exercise? That's the solution here to this?
Largely, yes. Now, if a child actually is showing signs of diabetes or early diabetes, you would probably want to treat that as well. But it's really about reversing the metabolic disease. That is going to take care of it. Because you do see this every so often, right? Somebody goes for an ultrasound for some other reason, usually an older individual, but sometimes a younger one too, and you get the report back that says, mild fatty liver disease. And of course, now that people result, they get scared, they call the office in a panic. And I think it's important to remember it's a condition that needs to be addressed, but it's not something that is an emergency either. It's really sort of an indication that the scales are starting to tip against you, and it's time to sort of rearrange aspects of your life to get healthier. And so, the question you asked me at the beginning, are you worried about this? I mean, I'm worried about this in the sense that it is definitely an indication that somebody's lifestyle is not as good as it should be and that changes need to be made.
If that's the case, when you go for your annual checkup, right, if you're a parent taking your child in there, is that typically the kind of thing that your GP would be looking at or trying to diagnose or even to see if it's an issue?
Well, certainly if your child is struggling with obesity and starting to show problems, it is something that should at least be considered. I mean, the usual way this workup happens is as part of a general lab workup, you would see somebody's liver enzymes being elevated.
Okay.
And then you'd be like, oh, okay, let's look into this. And then usually you can piece together what's going on. Sometimes it's found incidentally. If, somebody goes for an ultrasound for some other reasons, and the radiologist will incidentally report, by the way, there was some fatty infiltration of the liver. And again, that's usually a sign that you have to sort of explain what is going on here and then, be mindful of it and start taking the steps to try to reverse it.
So if there is even that indication, right, if it's not even to the point where we're going to say this is serious, something has to be done, but you have that first indication that there might, that, you have a fatty liver, or at least the beginning of one, is it enough at that point to simply say, okay, I don't want this to get any worse, and I will just change my lifestyle, my nutrition? Is that where you begin?
That is where you begin. And the problem is that, that's easier said than done.
Sure.
And of course, now we live in a situation where a lot of people don't have a GP, and you're sort of bouncing around from person to person at each visit, so you don't have that continuity of care that you might have had 20 years ago. But that is the thing. I mean, people often accuse me and accuse physicians in general of just being, pill pushers, right? Oh, take this medication. In fact, in many situations, if we could get people's lifestyle factors in order, that would be very effective. The problem is it's hard. We often don't have the resources to make it happen. And a lot of the things that you would normally want to use, like consultation to a dietitian, let's say, or, seeing like an exercise specialist, those things are often not covered by Medicare.
Right.
And so to pay out of pocket for that, if you don't have insurance, that becomes a little bit problematic. And so you end up doing the best that you can in the time you have available to you. And that's a hard thing to fit into a 15-minute visit. So I think most physicians are doing the best that they can. But that is the treatment. It really is the change of lifestyle factors to try to reverse some of the metabolic dysfunction that's going on.
Last question. If you end up in this situation where, you're diagnosed with fatty liver disease or your child is diagnosed with this, what's the outcome here? Are we talking about liver transplants at the end of this? What happens at the end of the road here?
Well, it's usually reversible. Now, if the thing is not addressed and the inflammation persists for years and years, what ultimately ruins your liver and every organ is chronic inflammation over years and then, cirrhosis, and then eventually the liver fails. But this is not usually what you see in this case. This is usually sort of an incidental discovery, and by treating everything else, blood pressure, diabetes, cholesterol, getting somebody to exercise more, you usually address a lot of these things incidentally along the way because you're sort of doing everything as a package deal. And I think that's the other point to remember is that we don't treat diseases in isolation. We treat them in conjunction. Right. And often what's good for your diabetes is also going to help you lower your blood pressure and reduce your risk of cardiovascular disease.
All right. Dr. Labos, appreciate it as always. Thanks so much.
My pleasure. You take care.
You too.